So for this handsome patient, what we're really looking for with the thread lift, which is a non-invasive facelift, and it's often called the silhouette soft lift, or in the old days these thread lifts were just little tiny sutures placed right below the skin. But the contour along the jawline, you can see there's some laxity here, but not ready for a facelift yet, and just a little bit of hanging here. So what I'm looking at when I do this is if I'm picking a single point of elevation, what's going to give me the best result along his jawline. And he's had a couple placed previously for the mid face, and we really want to go parallel to those because the vectors are all pretty much straight back. So if I do a finger here, this is going to help. If I do a finger here, that's going to help. And it's an 8 centimeter length with the 4 cone. So if I lay that on there with a marking pen, and we're going to distribute this over a bigger area, so we're not going to get a pinch like you see between my fingers. So we want to stay above that, but right at the jawline to get the maximum lifting effect. So I did the 8 centimeters, and I'm showing these as dots sequentially along that vector of pull that I've created with my finger. So if I go down all the way below his jawline, I won't see as much lifting. But if I go right at it or slightly above it, I'll see the maximum lifting. So that's really what we're looking for, minimum. And then the higher I go, I'm going to affect it less. So it ends up being these middle lines, and it really is a finger that represents what the thread can do. But there's a midway point here on this suture, and on the camera right side you can see that these cones, the suture and the cones are made of like a copolymer of polylactic and polyglycolic acid. Okay, those two are are really what the suture dissolvable material, which is for a lot of people attractive. I think they've recently gotten an increase in their duration of a lifting effect, which is 2 years. And so it's been originally 18 months. But the principle is that these cones are pointed one direction, and the other cones are pointed, if you're really zoomed in tight, you can see this, in the other direction. So are we at full macro there? I want it zoomed all the way in.
Yes.
Okay, so you can see the cone, and what the cones are restricted from movement by little knots. You see the knot here?
Yeah.
That are tied in the cone, so that if we try to advance this cone, it won't go any further. It's sort of on the thread, but I can't move it any further because the knot limits its ability to rotate along the arc here. So in that direction, and also you see on the open end of the cone, there's a limiting factor of a knot on the other side, so it can only go that far. The important thing about this is they're bidirectional, so these cones, this is the halfway mark, these cones point down or up, and these points point the other direction. And as you see in a minute, we go in the middle with these two, and I'll push the soft tissue over these cones in the direction of least resistance, and then the open end will resist the tissue falling back down the skin. And that's basically, it's a very simple principle. The key thing is you have to do this sterilely. I've had a couple people referred that have had infections, and you can pan out now if you want. So I'm going to start with a little drop of local around the entry and around the exit points. So we'll pinch here. And this is done sterilely. So we're in the operating room, but we don't have to use that. We're going to have an entry exit point right here. And I'm going to do a little drop here in the front. And really is pretty much all the local you need, but I'm going to come right along our track with just a small injection just so he doesn't feel any discomfort with the needle. And are you feeling any of those?
Not much.
Not much, good. So, well, after that, that'll just make it. So we were just sort of testing, because the jawline improvement is not bad if I go with my bottom dot line here, but the one that seems best, and it improves this labiomandibular sulcus here and the jawline, it's this lifting effect here. So this is the middle, midpoint where the little incision will go, and I'm going to make it between those two dots here. And it's really about halfway between these. Anything sharp there, Greg? Anything sharp there?
Mm-mm.
Take out that thing. So I've just made a tiny little puncture. You can do that with, I usually don't have it on the field right now, but an 18 gauge needle is totally fine to make that little incision. And I want to make sure it's into the fascial layer. That's where we're going to get the strengthening. You can see that little puncture, and I've dilated it just a little bit. And then the entry and exit points are important. Pinch this up, and we want to get into the sub Q. And we're going to just run really straight parallel with our little needle there. And the deeper sub, I don't want it to grab anything. So that's the deeper sub Q tissues. And we're going to exit in and around our little point here. Definitely want to be above the jowl. You want to be lifting that. So once that's through, I'm going to feed that little, and now you can see the little cones are oriented so that there's very little resistance. A little bit, but not a lot, and then we're going to come back. So we're going to be ending up trimming that wherever we feel it's appropriate, because the cones are engaged now. I'm going to do that same thing on the other side, and I'll just have you hold this out of the way. So I'm doing that in such a way as to avoid the stitch down below, and I can see my track here. The deeper fascial tissues are target to do the lifting, and I'll come out in the thicker skin here. The bearded skin really is the best place. We're going to be well below the skin surface, but you'll see the lifting effect in just a moment here. So I'll put my thumb there to act as a guide, so we're coming out perpendicular to the skin. And really the key here, so I want to be careful with that. I don't want to pull it all the way through, but I have really now the two ends that are, and I haven't fully engaged these yet, so the idea is to be positioned well with the little cones, and so I'm sort of swiping my finger over those and making sure that the skin here, the skin tissue, is really backed up. If you think about it, I'm trying to push it against the combs while I advance these, and the more I advance these, obviously, the more the cones are going to be lifting. So I'm going to continue, and if I see a little bit of a cone coming out here, that's okay, because we don't need every one of them. We want to have as many as it's required to get the lifting effect that we're looking for. And with each little lift or tug, I'm getting that advance that we're looking for here. So I've lifted him quite a bit already. And if I let that go, you see it's holding that point. My little knot here indicates that there's a cone nearby. So this was almost going downward before at the corner of the mouth. And the lifting effect you can see there's no incisions. That's the key thing. So that's down below the skin surface.